Today on Nursing Matters, what AI actually means for nursing jobs. The real answer. I'm Christina, and this is your daily dose. Let's get into it. So I want to start out talking about a headline that's vibrating really through every hospital boardroom and recruiting office in the country right now. The American Nurses Association recently released a formal position statement affirming that AI is a tool to support nursing practice and not a replacement for it. This is great news, as I love that they're looking at it from the right perspective. They're calling for nurses to be active participants in how this tech is implemented. Now, look, I've spent over 20 years in the trenches of healthcare talent acquisition. I've recruited through the nursing shortages of the early 2000s, the EHR transitions, and the chaos of the pandemic. And right now, the conversation around AI is super polarized. You have on one side the tech evangelists acting like a robot's about to handle your next 12-hour shift. And then you have the other side where there's fear that the profession is going to be automated into oblivion. So both of them are wrong. The good news, this isn't about replacing people. It's about the reality of how we're going to stabilize a workforce that is currently stretched to the breaking point. I'll tell you exactly where I stand because I see the data and I hear the stories from the front line every single day. AI will absolutely change nursing practice, and frankly, it is the lifeline that everyone's been waiting for. Think about the documentation burden. For 2 decades, I've heard nurses tell me that they're leaving the bedside because they spend more time with a keyboard than with their patients. If AI can act as a digital scribe, listening to an interaction and drafting the narrative note, that's really not a threat. It's a retention strategy for healthcare facilities. If an algorithm can flag a deteriorating patient 20 minutes before a code happens, that's not replacing a nurse. That is saving lives, and it's giving the nurse the superpower of foresight. But here's the gut truth that no software engineer in Silicon Valley can replicate. AI will never hold a patient's hand. It will never sit with a grieving family member at 3 a.m. It will never possess the clinical intuition to know when a patient needs cold, hard honesty versus they just need a glimmer of hope. In my 20 years of recruiting, I haven't hired, quote, tasks. I've hired human judgment. That judgment is not a feature that you can code. The nurses who learn to leverage AI as a high-powered assistant will be the most sought-after talent in the market. They won't be replaced. They'll be untouchable. Quick pause here. If this episode is helping you, make sure you hit the like and subscribe button so you don't miss what's coming next. And if you want more tools, job strategies, and real career guidance for nurses, head on over to rnnet.org. That's rnnet.org. Everything you need to grow your career is right there. Now, let's get back to it. Let me get specific because this is not theoretical anymore. This technology is already in hospitals, possibly yours, most likely yours right now. And I want you to know exactly what it looks like on the ground. So first of all, we have ambient AI scribes. Cedars-Sinai Medical Center is already piloting an AI mobile app called Ava Nurse Assistant. And it's spelled weird, so I had to pause for a minute. It's Ava Nurse Assistant. Nurses use their phones to document patient information in real time through voice dictation. The app transcribes it, and once a clinician validates it, it files directly into the EHR. No more end-of-shift charting marathons. Epic is testing similar ambient documentation tools with Microsoft across 9 major health systems: Baptist Health, Mercy Hospital, St. Louis, Stanford Healthcare, 9 systems right now. This is not coming. It's already here, guys. And the data backs it up. A Duke University study found that AI transcription reduced note-taking time by roughly 20% and cut after-hours work by 30%. Mass General Brigham saw a 40% reduction in physician burnout from AI scribes within just a few weeks of deployment. Charting time dropping 20 to 40% in real-world deployments. That is tens of thousands of nurse hours returned to the bedside every single year in large health systems. Also, we have predictive analytics, the early warning system, and this is critical. This one is the game changer for patient safety. 71% of non-federal acute care hospitals in the United States now report using predictive AI integrated directly into let me say that again, directly into their EHRs. 71%, that's huge. One AI sepsis prediction system documented a 20% reduction in sepsis mortality and cut average ICU length of stay by nearly 2 days. The same system resulted in 1,800 fewer blood cultures over 6 months and reduced nursing labor by the equivalent of 9 full working days. That is not a pilot program fantasy. That is a documented clinical outcome. Let's talk about fall prevention, pressure injuries, delirium. These are the outcomes that haunt nurses, the ones that keep you up at night wondering if you missed something. AI-powered fall prediction models are achieving accuracy rates that legacy tools like the Morse fall scale simply cannot match. One model reached a C statistic of 0.96, meaning it was right 96% of the time. When you consider that a single injurious fall extends a hospital stay by 6 to 12 days at a cost of $19,000 to $32,000 per event, the case for these tools isn't just clinical. It's financial, and it removes a weight from the shoulders of every nurse on the unit. Medication safety, another biggie. AI vision systems are now being tested that can scan a nurse's medication bag and the patient's ID simultaneously, cross-referencing both to ensure that right drugs are used at the right dose, flagging errors in real time during what we know is one of the busiest, most distraction-prone moments of a nurse's shift. That is not surveillance. That is backup. That is a co-pilot. Now, I'm going to say something that might make some healthcare executives uncomfortable, and I apologize in advance, kind of, because I've been doing this a long time to know that good technology deployed badly becomes the most expensive mistake a health system can make. Here's the crisis hiding inside the AI rollout. Nurses aren't always being brought to the table. A brand new 2026 State of Nursing survey just dropped, and the data is alarming. Only 25% of nurses say they've personally used AI-powered tools as part of their work in the last 30 days. Only 22% say they trust AI tools to support safe patient care in their current environment. And 60% of nurses who have been exposed to AI tools say their employer has not provided adequate training for what they're expected to use. 60%, that's crazy. Here's what makes this statistic dangerous. This isn't just a frustration issue. A nurse who doesn't fully understand how a documentation AI generates its output may not know when it's wrong. A nurse who hasn't been trained on the limitations of a clinical decision support tool may override correct information or correct intuition in favor of an algorithm's recommendation. The Institute for Healthcare Improvement has been direct about this. Relying on clinicians alone to double-check the accuracy of AI results is an unreliable safety strategy. And 40% of nurses say they have no seat at the table where AI implementation decisions are being made. No seat at the table. For the people who are going to live with these tools on every single shift, that is not a technology problem. That is a leadership problem, and I think it's time healthcare executives wake up. Let me bring this into my world now, because this is where I spend my days: talent acquisition, onboarding, and retention. And I need healthcare leaders to hear this clearly. The employee value proposition has fundamentally changed. Nurses don't just want a sign-on bonus anymore. They want a manageable workload. They want to feel like the environment they're walking into is set up for them to succeed, not set them up to grind them down. When you implement AI that solves a specific nursing pain point, charting redundancy, staffing logistics, early deterioration alerts, you make my job as a recruiter 10 times easier. And we aren't just selling a job anymore. We're selling a modernized environment where the technology actually supports the human. That is your differentiator in a competitive market. That is what gets a candidate to say yes when they have 3 offers on the table. But here's the other side of that coin. When you roll out AI without frontline input, when nurses feel like technology is being done to them instead of with them, you don't just have a training problem, you have a turnover accelerator. You'll spend millions on shelfware that sits unused while your best nurses walk out of the door because they feel unseen and unsupported. I've watched it happen many times. I've recruited for the aftermath of exactly this scenario. The ROI on AI isn't just in the efficiency of the machine, it's in the sanity and the loyalty of the person using it. So when I'm in a talent acquisition strategy conversation with someone who asks me what our EVP looks like right now, I'm asking leadership, what's the AI strategy here? Are your nurses using it or avoiding it? Did they help design it or were they handed a manual? Because the answer to those questions tells me more about your retention risk than any exit survey ever will. Okay, now let's talk about you, the nurse listening to this right now, because here is the career reality that nobody is spelling out clearly enough. There is a window right now, and it is open. The nurses who position themselves at the intersection of clinical excellence and technological fluency are going to be the most valuable professionals in healthcare for the next decade, period. I want you to think about this like a power play, not a defensive move, an offensive one. The American Association of Colleges of Nursing now identifies digital health literacy and nursing informatics competency as essential skills for every entry-level nurse. The American Nurses Credentialing Center offers nursing informatics certification, the RNBC. That credential is going to carry weight in ways it never has before. Graduate programs in nursing informatics are filling up because smart nurses see what's coming. But you don't have to wait for a degree program to start. Here's your move right now. Find out what AI tools your facility is currently piloting. Ask your CNO or your IT leadership, how are we ensuring frontline nurses are guiding this implementation? It's a very serious question. When you ask, you stop being someone who technology is happening to, and you start being the person who shapes how it's deployed. Get curious about the tools. Learn what ambient documentation means. Understand what a sepsis prediction algorithm is actually looking at. Know how to critically evaluate an AI-generated output, meaning know when to trust it and know when your clinical gut should override it. That skill right there is not replaceable. That is human judgment in partnership with machine intelligence. And that combination is the most powerful thing in healthcare right now. The nurses who lean into this, who get certified, who advocate for frontline inclusion, who become the bridge between the clinical world and the technological world, those are the nurses who are going to be leading departments, consulting on implementations, and writing the standards that the rest of the profession follows. You will not be replaced. You will be the one setting the table. So if you're a nurse or a fellow recruiter listening to this, here's your homework. Don't wait for the all-staff memo to explain the new tech. Find out what AI tools your facility is currently piloting. Ask your CNO or your IT leadership, hey, how are we ensuring the frontline is guiding this implementation? When you ask that, again, you stop being someone who tech is happening to. Understanding how to bridge the gap between clinical excellence and technological efficiency is what will define leadership in the next decade of healthcare. Like we've said, the door is wide open. Don't just wait to see what the tech does to the job. Help us decide how the tech is going to save the profession. And that's powerful. The heart of healthcare is human. And after 20 years in this business, recruiting through shortages, through pandemics, through every transformation this industry has thrown at us, I know this one thing that will never change. The machine will get smarter, the tools will get better, but the nurse at the bedside, the one who sees the whole person and not just the data point, that nurse is irreplaceable. Go be that nurse, and then go teach the machine how to help you do it even better. That's your daily dose for today. Share this with a nurse who's worried about AI. I'm Christina. Keep showing up because nursing matters. Thank you for listening to this week's episode of Nursing Matters Daily Dose. Are you interested in more career resources? Then hop on over to the RN Network at rnnet.org. Also, while you're at it, hit that like and subscribe button and share this episode with one nurse who really needs to hear it. Thanks so much, and we'll see you next time.